Hi, I'm Dr. Yen Reyes. I'm an infectious disease specialist and a pediatrician. I will be talking about medical updates, lifestyle, and health. So please subscribe to my channel and click the notification button. Enough! I'm overwhelmed. That is my usual reaction to technology overload. I am 51 years old and I belong to the Gen X, the generation who are not technology wired. I am Dr. Yen Reyes and I'm a pediatric infectious diseases specialist. Since the pandemic started, a lot of COVID patients were referred to me. Since COVID is a novel or new virus, the management for COVID is not yet written in the books nor in the journals. This pandemic taught me how to use Zoom. I opened my first Zoom account last March 2020 because I need to listen to the Chinese doctors on how they manage their COVID patients. I was so scared of technology then, particularly Zoom. But then eventually I realized that it became a need and it became a system. Eventually we had conferences and Zoom meetings with Singapore doctors, Taiwan doctors, and other doctors all over Asia and all over the world to discuss good practices about COVID. I cater to a lot of COVID patients. It is so scary because I really can't see my enemy. It is just like a battle against an alien foe. Like for example, when I went to the room of a patient, two of them has COVID, and then there are kids, two kids has COVID, and then the mother also has COVID. I go to their room and then I'm sure that the viral load is so high there. But I really have to go inside because I have an oath that I should take care of the sick patients, and I have an oath that I should at least heal them properly. So I really have to go inside patients who have COVID. So I only admit patients who are symptomatic and those who are really admissible. Part of the infection prevention and control is not to admit patients who are asymptomatic or mild. And partly because there are only a few rooms available in the hospital. So those patients who are mild and asymptomatic, we don't admit them anymore. So another help that technology did to me is through telemedicine. For patients who are asymptomatic and mild, I do home care through telemedicine. I had a crash course of telemedicine during the start of the pandemic, and through telemedicine, I can decide if the patient can be admitted, if the patient can be managed through home care alone, or if I need to see the patient face to face, or if the patient needs to go to the emergency room. During the early part of the pandemic, I used to give written instructions to the patients on how to take care of themselves, what are the food to eat, how to do breathing exercises, and what to do so they won't infect others. But then I realized that a lot of them don't read written instructions. They suggested to me that I should do video instructions for them. So during that time, I realized that I have to take any alternatives to cater to my digital patients. That is the start of my YouTube journey during the pandemic. I usually made lectures in Zoom and upload it in YouTube. Little did I know that it is called a content creator. During that time, I made a YouTube video on home care for asymptomatic patients. I was so amazed that it got more than 40,000 views. It may be simple for others, but to my naive self, it's a whole new world to me. I can't imagine that it can reach to a lot of people. I also received a lot of messages thanking me for that it has helped them. So in a way, it was the start of me embracing the digital world. A few days ago, I called up my nephew in the US to greet him for his birthday. He introduced me to his new girlfriend, and he said that this is my Auntie Yen. She is a YouTuber. I was taken aback because I honestly have 6 titles under my name, but none of my titles were mentioned. He didn't even mention that I'm a pediatric infectious disease specialist or I'm an assistant professor in University of Santo Tomas. But he mentioned that I am a YouTuber. They all said that introducing me as a YouTuber is the most interesting job I ever have. Oh my gosh, I'm not even updating my YouTubes, but thinking of that, I am considering my digital career as one of my careers in the future. I got so engrossed with all my COVID patients until a patient of mine got measles because the mother was so scared to bring the patient to my clinic for vaccination. Had the patient been vaccinated, the patient wouldn't have measles or its complications like pneumonia and seizures. So this is a very, very sad wake-up call that I really need to address this. The patient needs to go back to the basics of health. The most important thing in the universal healthcare is really prevention through vaccination. There are a lot of vaccine preventable diseases, and most of them will not have that disease or will only have mild symptoms if they are vaccinated. In order for the patients not to be scared to go to my clinic for vaccination, I have to devise ways so that they won't be scared. First, there has to be an appointment system. Because of technology, I was able to open a messenger system. They have to send me a message that they want to have an appointment on that day. So if they have an appointment, I will give them a health declaration to be sure that those who come for appointment during vaccination don't have cough, colds, fever, and they won't be infected with other persons. So all those persons who come during that day are just for vaccination. Second, I have to be sure that they have a time slot. Like for example, if their time slot is Saturday 10 a.m., the next patient will be scheduled at Saturday 10:30 a.m. So during that time, they can be assured that their time slot is only for them. Third, I personally do the vaccination in an outdoor setting. I make sure that there is proper air exchange so that the patient will be confident that there is a good air exchange, and then if ever there will be viral particles, it will be easily dispersed. And the fourth and the most important thing is I gave guidelines to my patient. I made a YouTube videos on what to do and what are the guidelines for them to go to the outpatient department and what are their guidelines for vaccination. This system helped me a lot because a lot of my patients come to my clinic for vaccination. The most important decision they made is for flu vaccination for the whole family. You know, flu vaccination is very important because flu symptoms like fever, cough, and colds is the same as COVID. So it is really their best decision to avoid flu through vaccination. Studies have shown that flu can cause complications like respiratory complications of pneumonia, blood infections like sepsis, and flu can even cause death. Studies have also shown that flu can increase the risk of having a heart disease by 10 times. Other data have also shown that flu can also increase the risk of stroke by 8 times. Some also reported that flu is really very deadly for children. So it is especially very important, and it's high time to really vaccinate, especially the kids with flu, since they don't have the priority list for vaccination with COVID, and it is the same symptoms as flu. It is best that they should be vaccinated with flu together with the whole family. I also made a video about this, and my patients are so grateful that they were able to understand it better through my video. This is just my simple journey as a doctor in this digital world. I am not digitally inclined, and I'm not even prepared for this digital technology. I was born and bred in Oroqueta City, Misamis Occidental, and digital technology came late to our place compared to Manila. My digital education is play by ear and self-directed learning. The digital world for me is like navigating into a very deep ocean, swimming into it in order to survive. We should embrace the digital world because it is now the new normal. After all, Henry Ford said that anyone who keeps on learning stays young. Thank you so much for your kind attention. Once again, I am Dr. Yen Reyes, now a content creator.